Now, 6 of the 7 officials from the Department of Health will be suspended by the end of today for alleged involvement in the Digital Vibes contract. The Health Minister, Dr Joe Phaahla, responded to the SIU findings into the Digital Vibes scandal. I'm now joined by the Progressive Health Forum's Dr Aslam Dasoo. Dr Dasoo, good to have you with us once again on the Daytime Update. So we've heard then from the Minister of Health. Your views, your sentiments, are you satisfied with what has come out today, specifically as far as accountability is concerned in the Health Department?
Good afternoon, Tommy. Thank you for inviting me again. Yes, look, I think the press conference that the Minister of Health has just had has clarified a number of issues, not least that action is being taken. And I think that is, a cause for some celebration, because this thing has been bubbling under the scenes, so to speak, for quite a while. And the entire tawdry affair has really knocked confidence, not just in the health system and the government, but also in the most important program of that government right now, the vaccination drive. So I think, yes, the press conference does go some way to demonstrating a willingness of certainly the Minister of Health to do something about the entire situation. The big worry, of course, is that the entire top structure of the department is in shambles and has been so for some time. And, many people are sitting in acting positions and so on. Now a number of them have been implicated and will presumably undergo the necessary law enforcement and disciplinary processes. But it doesn't really help us, because until we fix that problem and until the departmental superstructure is reinforced, we are going to be having a problem, especially now with the vaccination program. Many people there in the department have been there for decades, and there is a concern that they are just not up to the tasks right now. So a refresh of the personnel is an urgent requirement, and one hopes the disciplinary processes don't drag on. They don't need to at all. And because the SIU report is pretty clear, people should be dismissed and new persons appointed as a matter of urgency.
7 officials implicated, all senior. What impact does this have on the stability of the health department, specifically in a time such as this, where the fight against COVID-19 is still rife and the vaccination rollout still needing to kick in steam for us to meet the projected 40 million for December?
So you may know that, of course, health is at an operational level really a provincial competency. And the provinces are, at differing levels of efficiency, but the programs that they have are ongoing. The role of the department at the national level is to provide stewardship for the entire health system. And we know that the public health system in particular, over the past couple of decades, has degraded. And clearly that's one of the key tasks for the minister now, and for a national department comprised of people who know exactly what to do to fix that before we do anything else. The vaccination program is being rolled out. The sites are there, and fortunately the resources of the private sector are in full collaboration with the state. So one expects that in terms of the delivery of vaccine, that's okay and there's sufficient supply. But what we have noticed is that there has been a severe drop-off in uptake of the vaccination. And what they are going to do about that, I'm not sure. But I do know that there has been a severe dearth of proper communication to the populace in a way that promotes and builds confidence in vaccination. And this affair, this digital vibes issue, has certainly knocked that as well. So some serious thinking needs to be done about this. We are not going to reach the targets that they have, very ambitious targets for the end of the year, certainly. And we have an election coming up. People are off to the hustings. And we are fortunate that we are at the end of the third wave and that there isn't that much infection around. But as we know, greater mobility and gatherings, without adequate protection will cause cluster outbreaks and perhaps spur on the fourth wave sooner than we expect. So there's a huge measure of work and strategic thinking required right now. And the department at the top is stretched very, very thin. So it's a matter of grave concern. The only way you're going to deal with that is to clear the decks, get rid of the old dead wood, and bring in many people who are in society here that the government can employ in those positions, who know what to do. I'm not concerned about institutional memory. That sits mainly in the provinces. There's policy work that's underway, and there are many people who can fill that role.
We'll leave it at that for this afternoon. Dr. Aslam Dasoo from the Progressive Health Forum, his views there on the way forward for the Department of Health, with 7 senior personnel being suspended, as the minister says, by the end of the day. 6 of those who still remain in the employ will be receiving their suspension letters by the end of the day.